Hello everyone, and welcome to the 8th and final section of patient assessment entitled the Head-to-Toe Physical Examination. We can get started. As always, it's Keith Widmeyer with Wayne County EMS. If the patient is alert, they can direct the physical exam with their complaint and response. A patient who is not awake may still react during the physical examination. For example, the patient may respond to your voice or may withdraw from pain. A patient displays purposeful movement when they attempt to remove the stimulus. Non-purposeful movement is displayed when the patient moves in response but does not attempt to remove the stimulus. Be sure to document the patient's response to a specific stimulus. For example, the patient responded to a pinch on the wrist by pulling both arms towards the chest. Changes in patient's level of responsiveness are important findings that must be relayed to healthcare professionals to whom you transfer care. It's also important to document these findings in the pre-hospital care report. When you begin examining the head, use your gloved hands to gently feel the patient's scalp for DCAP BTLS. Look for any open wounds or discoloration. Make sure you look in both ears to evaluate for fluid. When assessing the face, assess for DCAP BTLS. Look at the patient's face for symmetry. When evaluating the eyes, gently palpate the eye sockets, the orbits, for instability or tenderness. Check both eyes for pupillary responses, utilizing the acronym PEARL, pupils equal and reactive, round to light. Pupils equal round and reactive to light. When evaluating the nose, gently palpate the nasal bones for instability or tenderness, as well as DCAP BTLS and fluid. When evaluating the cheek, gently palpate on the cheekbones for instability or tenderness, as well as DCAP BTLS. When evaluating the upper and lower jaw, gently palpate the upper jaw, the maxilla, and the lower jaw, which is the mandible, for instability and tenderness, as well as DCAP BTLS. When looking into the nose, look in for blood, fluid from the nose, and singed nasal hairs. Also look for nasal flaring, which is widening of the nostrils. When evaluating the mouth, look in the mouth for blood, vomitus, absent, broken, or lost teeth, an injured or swollen tongue, and foreign material. Note the color of the patient's lips and mucous membranes of the mouth. Note any unusual odors that may be occurring from the patient's mouth, body, or clothing. Assess the size and shape of the pupils and their response to light. Look in the eyelids for discoloration, cuts, swelling. Look at the whites of the eyes for discoloration. Look at the conjunctiva for redness, pus, or foreign bodies. Look in the ears for fluid. Look behind the ears at the mastoid process for any bruising. Assess the neck for DCAP BTLS. As well as what's known as JVD, or jugular vein distension. Look for open wounds, laryngeostomas, and the use of accessory muscles, such as the sternocleidomastoid. Medical alert tags may be worn on a necklace or bracelet. These ID tags contain important medical information, including the patient's medical conditions, important medications, and allergies. When palpating the neck, feel for the front and back of the neck to detect for areas of deformities or tenderness. Feel the position of the trachea just above the manubrium in the suprasternal notch. What you're looking for is termed tracheal deviation. This may indicate a pneumothorax or hemothorax. Assess the chest for DCAP BTLS. Note the shape of the patient's chest. Assess the patient's work of breathing, including the use of accessory muscles during breathing. Look for surgical scars, unequal chest rise and fall, bruises, open wounds, obvious deformities, and signs of a rash. Listen for breath sounds. Listen to the top of the lungs, mid-clavicular line on both sides of the chest. Listen to the bases of the lungs, and then the mid-axillary line on both sides of the chest. Compare from side to side. Feel the collarbone, shoulders, breastbone, and ribs for tenderness and deformity. Check for subcutaneous emphysema. Gently reach under the patient and assess the back of the chest. Gently reach under the patient and assess the lower back for DCAP BTLS as well. Remember, the abdominal cavity is divided into 4 imaginary quadrants. These quadrants are created by drawing 2 imaginary lines that intersect with the midline through the navel. The abdomen contains solid and hollow organs. Solid organs such as the liver and spleen bleed. When hollow organs are cut or burst, the contents spill into the abdominal cavity. This results in pain and soreness. Hollow organs include the stomach, intestines, and gallbladder. Using the pads of your fingers, gently feel the upper and lower areas of the abdomen for injuries and tenderness. Note any abdominal distension. If the patient has not complained of pain and there are no obvious signs of pelvic injury, assess the pelvis by applying gentle downward pressure on the pubic bone. Assess the extremities for DCAP BTLS. Look for open wounds, swelling, and abnormalities, and abnormal positioning such as an unequal length. Look at the wrists and ankles for medical ID tags. Gently examine the upper and lower portion of each extremity for bone or joint deformities and tissue swelling. Look for signs of possible insect bites, stings, or signs of possible intravenous drug abuse. Check pulse motor sensory in each extremity. Compare each extremity with the opposite extremity. Assess circulation in each extremity by feeling for pulses. Assess the dorsal pedal pulses on the top of the foot in each lower extremity. Assess the radial pulses in each upper extremity. Assess movement and sensation in each extremity. If the patient is awake, assess movement of the lower extremities by asking if they can push both of their feet into your hands at the same time. Assess movement of the upper extremities by asking the patient to squeeze your fingers at the same time. Compare the strength of the grips and note if they are equal or one side is greater. If the patient is awake, assess sensations by touching the hands and toes of each extremity and asking them to tell you which toe or finger you are touching. If the patient is unresponsive, assess movement and sensation by applying a pinch to each of the feet and hands. See if the patient responds to pain with facial movements or movement of the extremity. You may also consider assessing deep tendon reflexes, such as the Babinski response. Examine the upper leg. Examine the lower leg. Assess the dorsal pedal pulse in each lower extremity, and remember to assess movement and sensation in each extremity. Evaluate for DCAP BTLS. Examine the upper arm. Examine the lower arm. Assess the radial pulse in each upper extremity. Remember to assess for movement and sensation, and evaluate for DCAP BTLS. When you log roll the patient, assess the patient's back for DCAP BTLS. Life-threatening conditions must be managed as soon as they are found. Less critical conditions can be managed as they are found during or after completing the secondary survey. Examples include abrasions, mild burns, and lacerations. Provide wound care. Swollen, discolored, deformed extremities, provide immobilization. Minor bleeding, control bleeding, and provide wound care. You have reached the end of Chapter 17, Patient Assessment, and this is the end of the physical examination.